I'm Myra.
And I'm Danica.
And this is Black Women Healing Podcast.
And on this podcast, you can join us every Monday where we have raw, relatable conversations about mental wellness.
And we push you to do the work.
Let's heal.
This is Black Women Healing Podcast.
Hey, y'all, we're back with another episode of Black Women Healing Podcast. And we have another special guest, Dr. Jennifer. But before we introduce Dr. Jennifer, we're going to start off with a quote. So, Marva's going to love this quote because this is her lady. So it says, I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. By the late, great Miss Maya Angelou. Maya, what do you think about this?
As you were saying it, I knew it off the back of my hand. I feel like the quote is true. It's very true. How do I feel about the quote? Can you repeat it one more time? I just want to hear you read it.
Absolutely. I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel.
Yes. I think my mind just goes to like segments of life and the people that are involved in the feeling of it. Like, for example, teenage years being a hot mess but feeling really good, and the people that were tied to it that made it feel that way, like all the goodness of it. And even like now, like reflecting on my 20s and the people that played such big roles in the feeling of my 20s. So I think that is true. Like sometimes you can't remember details of things, but you can remember people that were involved in the roles that they played. I try to push myself to lean more in the positive of things because it's very easy to remember the negative of things, right? But the positive, I feel like sometimes we forget. And so pushing myself to lean more into that. So I love that quote. What about you?
I feel like I'm a all of them still. Like I'm a person who like I won't forget what you said or what you did. And also how you make me feel too. I feel like all of them for me is like impactful. So I can't explain it because I'm over here thinking about like people who maybe made me feel some type of way, but maybe the words didn't match the feeling or something. Like it really does change for me. So it's important how you make me feel, but what you say and what you do is really important to me too. So I'm just thinking about like for me how it shows up a little different. What about you, Dr. Jennifer?
I really like that quote, and I think to me it just speaks about someone's overall vibe, right? When we're looking back, I don't think people remember like the nitty gritty details, like, oh, this person didn't send an email on time, or there was a typo, or like, or things like that. I think it just speaks to the overall sense of like, yeah, I worked with that person, and my sense was that, oh, she was really competent. Or I worked with that person, and my sense was like, oh, she's really passionate. Oh, I worked with that person. I think she's really, dedicated to this community that she's working with. I think she's really energetic. I think she's really creative, right? But like the nitty gritty of like all of those things, we might over time, I think our memory for those things gets a little fuzzy, a little clouded, but it's like that sense, that vibe that you had with working that person that really lingers. And like, that's what we hold on to, over time, like maybe day to day, like what you say and what you do, like in those moments. But then when we're looking at the overall arc, like the longitudinal story that we tell each other about other people, it's, you're going to be like, oh, like this little detail, or she said this one thing this one way. Or is it like, oh, I just remember feeling warmth. I just remember feeling embraced. I just remember feeling really welcomed by this person and like the energy that they brought to the table. So, that's kind of what I take away from it. And, I think as a Black woman, I think it helps me not to like harp on maybe mistakes that I may have made in the past, like little details I might have slipped up on, or things I may have forgotten to do, or maybe I said something the wrong way, because overall, I think I'm coming with the intention, with the energy, with the capability, with the passion, with the competence, right? And I hope that's what I'm leaving people with. And it's not like, oh, I forgot like this period in my email to my boss, like the sentence didn't read right, and now everything is, ruined. Yeah, so I think it gives me a little bit of a time to step back and think about the way that I'm making other people feel in our dynamics and interactions.
Yeah. As you two were both sharing, it was making me think about her other popular quote, be a rainbow in someone's cloud. And my brain kind of goes to the two should kind of be tied together of when someone does leave a lasting impact on you, it does create that rainbow, but also people can bring a storm and they can add rain and they can add thunder. So just being mindful of how you decide to show up in people's lives, even if it's a stranger, because you just never know what people are going through.
Yeah.
All right, y'all. So as you hear, we have a special guest today. We have Dr. Jennifer. And Dr. Jennifer is a board-certified psychiatrist specializing in women's mental health and reproductive psychiatry. She is a graduate of Harvard College and the University of Virginia School of Medicine, completing her adult psychiatry residency at Harvard Medical School, Cambridge Health Alliance, and fellowship subsequently training at the Brigham and Women's Hospital. She also is a physician writer with a Master's of Science from Columbia University in Narrative Medicine. Dr. Jennifer explored her love of storytelling through her previous work as a medical producer on an Emmy Award-winning daytime television show. Today, she is a columnist for STAT, a life science publication backed by the Boston Global Media Group. Her work has appeared in a number of platforms and publications, from CNN to the Journal of the American Medical Association. Dr. Jennifer is also a passionate teacher who has taught a seminar to Columbia University medical students on writing as a form of medical student advocacy and lectured on topics at the national and local levels about topics ranging from birth trauma to the use of contraception in psychiatry. So, as we see, Dr. Jennifer has an extensive resume. And before we even really dive in, can you tell us, Dr. Jennifer, what does a psychiatrist do, and how does that differ from a psychologist and mental health therapist? So that way our audience gets some clarity there.
Yeah. There's a lot of overlap between what we do in those different professions that you laid out. But I think what's important to understand is that a psychiatrist is first and foremost like a medical doctor. Like there's different degrees to become a medical doctor. You can have an MD or a DO. Like a doctor of osteopathic medicine or a doctor of allopathic medicine. And that basically means that I've gone through medical school. So I am an expert in thinking about how mental health conditions interact with biological realities of your body. So when somebody comes to see me, I'm not only asking them about mental health symptoms that they have, but I'm also taking like a medical history. I want to know what medications they're taking, right? I can run labs. I can like order different tests, right? Like sometimes somebody could have depression that's caused by a brain tumor. There's no amount of talk therapy that's going to make that brain tumor get better, right? But it's a combination of like a physical exam, laboratory tests, imaging, things like that will lead to like a diagnosis that can ultimately lend to the healing. And so there are many medical conditions that actually overlap and interface with like mental health conditions as well. So as a physician, I'm a trained physician, I'm able to kind of bring all of those tools and modalities to the table, and, included my diagnostic interviews, a little bit beyond just like a mental health screening. I want to know about the person's medical health as well. Yes, psychologists, they're behavioral health, experts in human like mind and behavior. And they oftentimes do extensive research. Like psychologists are PhDs. Like psychiatrists are at a minimum an MD. They can also have PhDs, but at a minimum you have to have like an MD or a DO in order to be able to like practice medicine, right? But a psychologist can also have a doctorate, like a PhD or PsyD. A lot of times they do a deep dive in a particular topic. I oftentimes refer to psychologists sometimes to help better elucidate or clarify some symptoms that might be a little bit unclear from my evaluation. Like, for example, if somebody comes to me, I'm able to diagnose them with like ADHD, for example. But if somebody has ADHD symptoms and a cluster of other symptoms, and I'm finding it difficult in the time frame that I have to really do a deep dive and tease apart what that might represent, they might need a more specialized neuropsychological testing. And so psychologists oftentimes get really extensive training in psychological evaluations and assessment. And so I work with psychologists all the time. And therapists, like that's a broad category. There are many degrees or ways of training pathways that one can use to become a therapist. Like you could have like a master's in social work, or you can be a marriage and family therapist, for example. So there are many different ways one can become a mental health clinician. And I think the commonality to all of those training pathways is that they really teach you to use talk therapy to troubleshoot or solve specific problems as they relate to mental health. So that's kind of how I roughly lay out the professional network in my mind.
That's a great breakdown. Thank you so much for that. The differences that you pointed out, I feel like, are essential, and it makes it, because I feel like a lot of times people get clumped in together. I know my family still, I'm a marriage and family therapist, and they'll be telling people, oh yeah, she's a psychologist, she's a doctor. I'm not. I'm not, So the way you just broke it down makes so much sense. So how did you decide to go into this field and specifically specialize in women's mental health and reproductive psychiatry?
Yeah. So I guess that's a two-part story. So as I mentioned, like where I went to med school, the first 2 years are basically really intensive, like book learning, right? We go to lectures, we like learn about all the different body systems and organ systems. And then the second 2 years, roughly speaking, are our clinical years. There's a little bit sprinkled in on each side, but like those core clinical years, our third year, we basically go through the major specialties like OBGYN, pediatrics, like internal medicine, neurology, surgery. We kind of go through, and some subspecialties, as well, and psychiatry. And so I think I went into med school actually wanting to be a surgeon, just thinking like, I really want to have a tangible impact on people's lives. I want to know that, I put in X and I get out Y. I really wanted to be able to have like a job that felt exciting to me. I was also super obsessed with Grey's Anatomy, and I was like, obviously it's going to be like this. And then surgery was my very first rotation of my third year. And I found myself actually liking the clinic part of surgery more than the surgeries itself. And so when I told my colleagues that, they're like, yeah, most surgeons don't like clinic, so I don't think you're a surgeon. We really live for like the surgical part. And I just remember like being in surgery and being like, oh, this is taking a long time. Like this is I'm over this. I just didn't have like the patience for standing in an uncomfortable room like for hours and hours and hours at a time. And I used to like dread the surgeries because I'm like, oh, this is going to be the whole day. Whereas my other colleagues who eventually went into surgery were like so excited about like the longevity of like the surgery. And so, I kind of realized that was not my calling early on. But then I spent the rest of that third year really, you try on a hat, right? When you get into your pediatrics rotation, you try on a hat, you're like, can I be a pediatrician? Like, do I like working with this patient population? Like, do I like this like workplace environment? Do I like my colleagues? Do I like the things that we're talking to our patients about, right? Do I like the challenges? Like when I see people on their worst day, like are these challenges that I feel like I can do on a long-term basis, right? Because this is a career choice. And I felt very lost my third year because I was like, oh, maybe I could be an OBGYN because I have a little bit of that surgical element, but there is that element of like women's care, like advocacy. You could be more in clinic if you wanted to. You don't have to do too much surgical stuff if you didn't want to. But I just didn't jive with the OBGYNs in my third year. So I was like, oh, I don't think these are my people, right? Mm-mm. Then I got psychiatry was my very last rotation, and I didn't think I was going to be a psychiatrist. And I just kind of fell in love with it. The moment that kind of solidified it for me was I did a patient interview with an intern. So an intern is, after you graduate from med school, your very first year practicing and training is your intern year. And so I was doing a patient interview with an intern, and we saw this young man at a VA hospital who was really struggling with PTSD. Like he was having a lot of symptoms, like isolating from his family, like couldn't figure out what was wrong. And all we did was like listen to him tell his story. And then after that interview, she reflected back some of the symptoms that fit under the diagnostic kind of grouping of PTSD. And she's like, yeah, sometimes when people have PTSD, they struggle with this and this. Like, does that resonate with you? Does like that relate to your experience? And this man was like, oh my gosh, yeah. And he like was so down and forlorn the whole interview, but he smiled for the very first time when he felt seen in this interview. He's like, yeah, I do experience that. And it just gave him so much hope that there was like words for what he was going through. And I just felt that that was so powerful. Like, we didn't have to rely on any fancy tools. Like, we weren't in an OR. We didn't have like, I don't know, like a whole like surgical suite or like all these like fancy medical equipment. The tool was us. Like, we were the tool. We were the tool of healing. And I just found that to be so powerful. And so when I had that feeling, I was like, oh, I think this is it, right? I think this is a space where I need to be. Another profession I was considering was emergency medicine, because I felt like it was fast paced, and I liked that you got to kind of be an expert in like a bunch of things and like see people and like help them when they're really needing help. Like, people come into the emergency room and it's very clear what they need to do. And I'm not doing like a million other things. It's right. It's just this one problem. But I remember when talking to mentors, they were like, yeah, a lot of people can see themselves in a lot of different fields. But one way you can try and make your decision is figure out how much of what you like you can get in the other field. So, for example, as a psychiatrist, I also work in an emergency room as an emergency psychiatrist. So that kind of like fast paced, that kind of individual like problem solving, keep you on your toes, kind of like whatever walks in the door, you kind of got to address. I got that in psychiatry, whereas I didn't think I got to have as much of the things I liked about psychiatry in emergency medicine. So that's kind of what sealed the deal for me. And then you also asked why women's mental health. So after med school, you have to do 4 years of psychiatry residency training to become a general adult psychiatrist, basically. And then from there, you can subspecialize, because psychiatry is a specialty of medicine. You can subspecialize. And I chose to subspecialize in women's mental health after I had a baby. So during my 3rd year of residency, I had a baby, and technically I only had like 6 weeks of parental leave, but my program was generous and allowed me to do a reading elective, basically, that just allowed me to like work from home and do like reading projects or whatever from home. And so they wanted me to read about maternal and infant mental health. And I started reading and basically never stopped reading about maternal and infant mental health. And that's kind of what opened the door to the world of like women's mental health for me. And it was crazy to me that the only way I was exposed to this information was because I had a baby, right? None of what I learned was part of the general adult psychiatry curriculum. And so, once I started reading and the information just hit me at the right place at the right time, right? So I just wanted to learn more. So I attended conferences. I did a chief year in women's mental health. I started working in an OB clinic as like a psychiatrist there. So I was seeing a lot of different patients during residency who had primary obstetric issues, but then also the mental health issues were coming up and becoming part of their care. And so from there, I applied to fellowship training in reproductive psychiatry, which basically is how women's health intersects with psychiatry, and then more specifically, becoming expert in managing mental health symptoms as they interface with hormonal fluctuations like across the life cycle. So that's kind of how I ended up doing what I do now.
Yes, yeah. Thank you so much for breaking it down and letting us get a little personal.
Am I still here? Did I freeze?
Oh no, I can hear you.
Oh, okay, you have frozen.
If you freeze, let me put this in here. If you freeze, it just keep going. What like is saying that, but really our quality is way higher than it is. So if you freeze, just keep going. It should be fine. But so yeah, like I love the fact that you just got personal and told us how you thought it was going to be one way, but you followed as it was going another way. You didn't force it, like, oh no, it has to be this. You're like, no, it doesn't feel good for me. And then even furthermore, like you just said, as you had your baby and kind of how it started going a different way too. Again, you didn't like try to force it to be only this way. It's like, oh no, this makes sense for me. This feels good. So I'm going to follow it. I love that. So the next question just talks about what has been the most difficult part and also the most fulfilling part of being a Black woman that is a psychiatrist?
I mean, I guess I would say the most fulfilling part is that there aren't that many of us. Honestly, I think maybe 2% of psychiatrists are Black women. And so anytime I come across a patient it was kind of my experience across medical training, actually. Anytime you have a patient of color or, somebody from your community, they just, at the end of the interview, they'll be like, you know what, I'm so proud of you. You're doing this for us, not just me and my health, but like you're representing something much greater than yourself. And so I take that responsibility like very seriously. And it's actually just been quite fulfilling to be able to, mentor other people and kind of like help them along the way, give advice. I try to carry myself in a way that makes my community proud, like that sort of thing. So I think that's been really, really fulfilling. The challenging things I think are, navigating the things that Black women navigate in every other workplace, walking into work and your hair is different and everyone commenting on it or being like, I'm going to touch your hair, all those different kinds of dynamics. And, there's all of these conversations around diversity and inclusion and, what that means to the medical profession and what that means to the care of like under-resourced or underprivileged communities. And one of the things I find difficult to navigate and manage is like always kind of having to be a spokesperson for those things, right? If you're always going to be voluntold to like be on the diversity committee, or like, it's not that I don't want to be on the diversity committee, but it's just like, this is just an extra labor that I now have to, take on that other people don't have to take on. So I think it's kind of like a double-edged sword, like managing the privilege, the very real privilege that I have, as one of the few, but then also recognizing that sometimes it can be a burden as well, like being one of the few, being one of the only,
Yeah, for sure. I feel like you started to scratch the surface a little bit, but I'm even more curious about how your educational experience and then your life experience kind of like married each other and shape how you approach you being a psychiatrist.
My educational experience, how it shapes me being a psychiatrist. Well, one thing that I like about psychiatry is that I think it allows for us to meet our patients where they are, right? It allows, like, a huge part of my job is like listening, right? Prior to going to medical school, I got a master's at Columbia in something called narrative medicine, which was basically all about learning to listen as a clinician. And that degree basically was all about, it wasn't just like, oh, reading books makes you a better doctor, right? It wasn't just like being in the humanities makes you a better doctor, but it was more rigorous and disciplined than that. It was understanding what the context is of a story and how that's being told. It's understanding the tone of the story. It's understanding the baggage that I'm bringing into how I'm interpreting somebody's story, right? And it was so interesting getting a master's prior to med school because some of my classmates were actually doctors, right? They were doctors who were coming back to school because they felt like something was missing from the way that they were able to connect and interface with patients just based on the realities of practicing medicine. Like, there's not always time to like listen to someone's story. Your appointments aren't long enough. Like, you're overwhelmed with all the notes and messages that you have to respond to. And so I really took the lessons that those doctors were sharing very seriously. And so it kind of always is in the back of my mind that medicine is this fundamentally like human profession, right? And if we're feeling ourselves straying from that connection, then something's wrong, right? And so it kind of kept me grounded, like that love of storytelling, that love of like communication, that love of connection always keeps me grounded. And so when I'm feeling myself feeling frazzled, I'm like, okay, why am I moving away from what are the ways in which I'm being pulled away from this core value that I really want to pursue? So I would say that's kind of how my education kind of grounded me and like almost illuminated a path. It wasn't obvious to me at the time as I was going through it. Like I said, I really tried on all the hats and saw the way in which I could have gone in any which direction. But, looking back in retrospect, our stories, narratives always make sense in retrospect because we impart meaning, that meaning on them.
Yes, most definitely. I'm curious, how do you actively involve Black women in the decision-making process regarding their mental health and just considering the importance of patient perspectives and like autonomy overall?
Yeah, no, I think that's so important. And, as a Black woman who's experienced medical care in this country, myself, in my private practice, I do have the autonomy to design care the way that I feel is best, right? And part of that means creating space and creating time to be able to, again, listen. I always tell my patients, like, I leave them plenty of time to, like, ask questions. I want to make sure you answer questions. Because how many times have you gone to the doctor and you leave and you're like, what just happened? I'm not really sure what our plan is. I don't know. I think they're sending medication to the pharmacy, but I'm not quite sure. I don't even know what the name of the medication is. I don't want anyone to be leaving with any sort of sense of confusion or feel like they didn't have an opportunity to really voice their concerns, to ask questions, to be able to understand what our shared plan is. Because I always tell patients, like, you're the pilot, right? I'm just the co-pilot, and we're in this together. Ultimately, I can provide you with some direction. I can provide you with my expertise around medications, behavioral health treatment strategies, or other interventions. But ultimately, you're the one who's going to act on them at the end of the day. I'm not going to be home with you putting medication in your mouth, right? I'm not going to be home with you, like, making sure you go to bed at a certain time and wake up at a certain time if we're working on sleep hygiene. I'm not going to be there, like, making sure that you're eating all the colors of the rainbow in terms of, your diet in order to, like, get all your phytonutrients that you need for your brain to make those feel-good chemicals. All I can do is, like, really talk to you about them and talk to you about my experience with them, what the evidence behind them is, understand what your motivations are, what your goals and your priorities are, and then we reassess, right? Next time I'm like, how did that go? Did that work for you? What were the challenges that you ran into when we were trying to implement this treatment plan? If it's not working, we troubleshoot that. And if it's just like it doesn't align with you, then okay, back to the drawing board. We'll find something else. So it's not my way, or as a doctor, it's not my way or the highway, right? It is, what are your goals? What are your values? What are you trying to accomplish? Because you being here and sitting with me is an investment in your mental health, and I want to make sure that you are getting the most out of it.
Yes,
so I just really make sure that patients have the opportunity to say what it is that they need to say and, like, be the captain of their own destiny. There may be some obstacles and I can totally help you, like, smooth those out, but at the end of the day, you're the captain.
Yeah. Dr. Jennifer, I'm curious because I have clients that'll come to me and they're kind of confused on, like, if they need to see a psychiatrist, a psychologist, or just a marriage and family therapist, because that's what I am. And so I'll have a conversation with them about, like, just some of, like, the levels of, like, if you're wanting to try out medication, I can collaborate with your psychiatrist. And sometimes I'll get, like, mixed reviews of, like, I've been to a psychiatrist and this was my experience. Or I'll hear people say that I had a psychiatrist that was almost like what we're doing in talk therapy, which I feel like causes some confusion there, especially if you talk to a friend that's seen a psychiatrist of, like, do I go to a psychiatrist or do I go to MFT or a social worker? So I'm curious if you can give some clarity to reasons why one might seek out a psychiatrist.
Yeah, no, that's a great question. So psychiatrists can do talk therapy. Like, we are trained in being a psychotherapist, and there's many different types of psychotherapy. And we have, depending on what kind of training or extra training you pursued, you can definitely get therapy from a psychiatrist. Working with a psychiatrist also gives you the added benefit of exploring medications as a potential part of the treatment plan, or other types of interventional psychiatry treatments as part of your treatment plan if needed. So for me, sometimes I have patients coming to me and just because they want the option, they want to keep the option open, but they're like, I don't know if I want meds. I kind of want to explore it, but I want to keep the option open, but I don't know if I want to go down this path just yet. So I help them think through, how do we determine where meds are indicated and where they're not, right? Because I also have training in integrative psychiatry. So I understand how supplements can come into play, like nutraceuticals, like, things that target, biological symptoms, but they're not prescribed medications. So I tell people to think about symptoms on a spectrum, right? If somebody comes to me and they have, like, mild to moderate symptoms and they're not really interested in medication, or they're just hesitant about medication, I would say, let's give psychotherapy a solid try. whether that's with me or with another therapist. Let's give psychotherapy a solid try. And this is you really trying, right? It's not half-assing, like maybe you show up to a session, maybe you don't. No. You're going. If the therapist gives you homework, you're doing the homework. You're implementing some of the like tools and strategies that are being taught to you. And I always give people like an endpoint. I'm like, let's try this for a solid maybe 12 weeks. Okay, with you actually trying, you going, you're finding a therapist who you connect with, and then we'll see what are your symptoms at the end of those 12 weeks. If your symptoms are starting to resolve, then that's great, right? But if your symptoms are not resolving or they're worsening, then other interventions may be need to be layered in at that point in time. If somebody comes to me and they have like severe symptoms, then I'm like, okay, yes, we should probably start off with a medication, because sometimes medication can create the room. You need to do the good work in therapy. Like if you are burdened with anxiety, like you have spiraling thoughts, racing thoughts all the time, you can't focus because you're always worried, you can't leave your house because you're terrified about what happens when you leave the house, like your relationships are starting to struggle, your work performance is starting to struggle, right? Sometimes you just need some sort of like intervention that kind of helps you to be able to get to the core of why those things are happening to you, right? It's hard to look at patterns when you are so wrapped up in the anxiety that it's hard to even engage in the talk therapy, right? It's hard if you're even anxious about going to therapy because the anxiety is like kind of taking a grip too much, or if somebody, for example, obviously on the more extreme end of things, somebody's struggling with like suicidal ideation, or, they're like, they're so depressed, they're starting to have those kinds of thoughts, I may be more willing to like suggest, medications may be more indicated in that period. And then I also help people figure out what is the end goal here, right? Because sometimes people start medication and for them, staying on it indefinitely is a good course of action. But sometimes for other people, it's just an episodic thing. It's like, okay, we had these symptoms. It's like when you break your leg, you don't wear the cast forever. You wear the cast until the cast heals, right? But while you're wearing the cast, you're also doing other things to facilitate healing, like maybe not putting weight on the leg with the cast on it. Like you're doing all the things, right? So that when the cast is taken off, your leg has been able to have the time and space to engage in the healing. So same thing with medication. Like sometimes the medication creates the healing and adjust some of those imbalances that may have, been in place, right? And then when you feel better, if we're going to pull back on the medication, I want to make sure that you are living an antidepressant life, that you are living an anti-anxiety life. Like if we're going to take away one of the tools that helped you, we're replacing it with things that are going to sustain your wellness in the long term. So sometimes people are like, well, I don't know if I don't want to be on meds forever. And also another one that I get is, are meds going to change who I am? When I always joke with people that psychiatrists are the only medical specialists who have to bargain with the organ that we're trying to treat. Like your brain is telling you, oh my gosh, be so anxious about this medication. Don't trust it. Right. But the cardiologist doesn't have to like negotiate with the heart. The orthopedic surgeon's not negotiating with the leg. It's trying to fix it. Yeah. But yeah, I always tell people like, medications don't change who you are. They just kind of bring you closer to who you actually are, right? You know what changes who you are? Mental illness, depression isolates you from your family, from your friends. It takes away your skills and capacity to like perform at your highest being. Crippling anxiety does the same thing. And so if medication can turn the volume down on all of that, it allows you, in your authenticity, to come forward, right? It's kind of like an Instagram filter. You kind of take the depressive filter off, take the anxiety filter off, take the trauma filter off, like take all that stuff off so you can see clearly what it is that your life is and engage with it to your highest capacity.
Wow. Yeah. Thank you for that breakdown. I feel like I really needed that. Now, I even feel like I have a new level of understanding because I've never heard of integrative psychiatry either. And so just even hearing that, I'm like, okay. Thank you for that breakdown.
Yes.
Yeah. Psychiatry, it's just kind of, it's not anti-medication at all, right? It just looks at medication as one possible tool in a holistic treatment plan. So therapy can be part of an integrative, psychiatry treatment strategy. Supplements can be part of that. A lot of like behavioral or like lifestyle interventions can be part of that, like making sure that your sleep hygiene is on point. A lot of people undermine or don't really recognize the importance of sleep in a mental health plan. They don't recognize the importance of like nutrition in a mental health plan, right? They don't recognize the importance of like being exposed to nature and natural environments, right? That can be a very important part of like a mental health plan, or like exercise. Kind of like takes a holistic look at your functioning and offers suggestions or interventions that kind of help you get to a better place.
Yeah. Thank you so much for breaking that down. And it's just also refreshing to hear a psychiatrist like being open about like medication is not always the only thing or first thing that it has to be discussed. And I think sometimes we hear that of like, oh, okay, if you go to a psychiatrist, they're just going to push medication on you. And you're like, no, we're going to look at this in a holistic approach, and we're going to talk about your different options. And I absolutely love that. So thank you for doing that work and showing up for your patients, for your clients like that. So we always do a takeaway. It could be anything that you want to leave with the listeners. So Dr. Jennifer, what would you say your takeaway would be for us today?
My takeaway, I wish there aren't that many psychiatrists of color and, therapists of color as well. Sometimes we're hard to access, we're hard to find, right? And I always think you don't have to be in crisis. You don't have to be, at your wit's end or broken down in order to want better for yourself or better in your life. So in terms of a takeaway, like, I would love for everyone to take a couple of minutes to find what your mental health resources are in your community that you have available to you, whether you're pursuing them through insurance, whether you're paying for it privately, just finding what your resources are. And so if you were to ever need them, you have them right at your disposal. Because it's the hardest thing to do when you're in the throes of crisis, to then at that point start trying to find a needle in a haystack. So I think just kind of becoming more familiar with what resources are available to you, like familiarize yourself with the directories, the popular directories, maybe talking to your friends, like seeing, have you worked with a therapist before? What was your experience? Do you mind if you share their contact information? Because you don't even have to use that therapist particularly, but therapists, psychiatrists, we all have referral networks. And so you can get connected through one of us as well. And so, especially for moms, pregnant moms, like you might feel well now, but like when baby comes, you might not feel well. And at that point, you're juggling new motherhood, you're juggling a baby, and trying to find a psychiatrist or a therapist on top of that. It's a heavy lift. And so I feel like we would ease our burdens if we were just more familiar with what was available to us and just kind of had those resources at your fingertips, so should you need them in the future. And then also, you don't have to be, like I said, you don't have to be in crisis to start doing the work. If you want better for yourself in any aspect of your life, a therapist can help you get there. If you're wanting better in your relationships, if you're wanting to build more confidence, if you're wanting to build more self-esteem, if you're wanting to change dynamics or patterns in your life that just kind of rub you the wrong way and you feel like are getting in the way of you just kind of being fully self-actualized, a therapist can help you get there. So you don't have to be in crisis, right? You don't have to be breaking down and crying every day in order to need help. And so for Black women specifically, I think that is an investment in yourself, taking that step to get a therapist who can kind of hold your hand and walk you through those transitions.
Yes, absolutely. Like this piece of stay ready so you don't have to get ready. That's what's stuck in my head the whole time, right? I love that. So thank you so much, Dr. Jennifer. We're going to put all your information in our show notes. We hope you stay connected. And this has been a great episode. So thank you so much.
Thank you for having me. I really appreciate it. And a lot of gratitude to both of you for the work you're doing.